Well, welcome back to the Good Medicine Podcast. Our podcast, we explore the innovations, the people, and the ideas that are shaping the future of health and healthcare. I'm your host, Dr. David Beers, and I'm thrilled today to be joined by Dr. Adam Sharp, the CEO of Galvan Health. Dr. Sharp, I'll call you Adam. We're good friends, so Adam has a really interesting background. He's not only an emergency medicine doctor by training, but he also has a master's degree in. And Adam, you got to help me out here. I want to say that it's in public health, but I know it's not. So tell me what your master's degree is in.
Yeah, it was part of the Robert Wood Johnson Clinical Scholars Fellowship, and it's a master's in health and healthcare research from the University of Michigan.
So kind of a unique perspective that Adam brings, being a practicing physician, but also have done academic work and work in his professional life, looking at healthcare systems and researching our healthcare systems. And so we're going to talk today with a little bit different angle, not talking about making new medicines or how we prescribe or identify patients to treat, but talking about our healthcare system in general. And, I think Adam and I joke a lot about, we're very happy to say what's good and bad, but unfortunately, I think in today's world, we probably are going to spend a lot more time talking about things that we think need to change and need to be fixed. And hopefully we come up with some ideas and share some discussion today that will be helpful as we're starting to think about the future and how we can make things better. And I think at the end of the day, that's really what we care about. I look at our healthcare system, and it's not unique to the United States. I think it's kind of the world is kind of facing the same situation where we've made massive medical advances. We have, just in our lifetime, and Adam and I are similar age. I'm a little older than him, but, in our lifetime, just think about how things have changed since we were kids and what we can do today. It's amazing and how far we've come. But on top of that, we have a delivery system for how we administer healthcare to our population that I'm not sure we could do a worse job designing it if we actually tried. Like if we sat down and said, what's the worst way that we could possibly design a healthcare system to function? I'm not sure we could come up with something worse than we actually have. So it's and there's a lot of reasons why. And it's obviously the complexity of the whole, the amount of information, all of those things, it contributes to it. But I think there are some things that we're learning and some things that we'd like to talk about today on the podcast about our healthcare system and how we could potentially change things and what Galvan's trying to do to change things. And Adam's one of those guys that I love talking to because all he's trying to do is change the whole world of how we deliver healthcare to the whole world. So that's it. That's something simple, right? So before we jump into all of that, I'd love to hear what led you, as you went to medical school, you got a master's degree. I know you were a practicing physician, you're emergency medicine physician. What started to kind of work in your mind to think about, hey, maybe I'm going to shift what I'm doing full time and start working on a solution for healthcare. So what led you to start thinking about that, Adam?
Yeah, there's a long answer to that question, Dave, because the reality is it was a little piece at a time. And I'll say I was the first in my family that had gone into the health professions in any profession, let alone medical school. And I was surprised at each little bit of training I got at how amazing we were at certain things and how really terrible we were at some really basic things. And so, to answer that question of how I got to where I am, I will say that, I went to medical school at the University of Utah. I loved my training. A lot of really, brilliant people there that I appreciated. I loved my time at medical school. And then I loved a little bit of everything. So I did emergency medicine, and I was trained in Indianapolis, and I loved, they had an excellent residency director who that's why I went there, but they had an interesting program because it was under an academic umbrella of Indiana University. And there was a county hospital and a community hospital. And so we kind of had the three types of hospitals. Often you think about community, county, and academic. and it blew me away at how variable the medicine was that was practiced, certainly within a hospital, depending on which physician was working that day. And then if you looked across hospitals, the hospitals we trained at were literally a mile apart. There's in Indianapolis even a little monorail that connects them, and totally different. And I thought, well, this isn't what I expected. I expected to go and learn the best practices and then to try to do them as a physician as part of my training. That's what led to my research fellowship. I was not a born researcher like you, Dave. I came at this because I saw, well, if we have objective scientific methods to prove which one's right, wouldn't everybody want to do the right one?
Yeah.
Wouldn't we all want to do that?
Yeah.
So I went and did as I mentioned before, a research fellowship at the University of Michigan. It was sponsored by the Robert Wood Johnson Foundation. At that time, they've adjusted a little, but the first paper that I wrote, where they taught us how to use Stata, so I had to go in and actually do this statistics. I learned how to do it, but then subsequently I was grateful for people who were actual biostatisticians
Experts,
to do that.
Yeah.
That's right.
Yeah.
But the first time, so one of the things that bothered me as an emergency physician was the lack of resources. Emergency departments are open all day, all night, every day of the week. And so if you saw somebody 9 to 5, you had certain resources, but in the evening, you may not have all those resources. And certainly on the weekend, you may not have them. So there was a big representative data set of all patients coming into U.S. emergency departments. And I thought, wouldn't it be helpful if people knew that people were more likely to die if they came in nights and weekends? Wouldn't that change our behavior? And I remember my, very bright fellowship director was like, well, what do you think people are going to do about it, Adam? And I was like, well, they'll change.
Of course.
They'll change.
Yeah.
Well, nobody wants to be at higher risk of dying or having bad outcomes because they got sick at the wrong time of day. And so we wrote the paper, and not surprisingly, we showed that, yeah, you're at higher risk of death if you come in evenings and weekends, and nothing has changed. Yeah. I mean, nothing changed at all. And so that led me again to come out to a giant integrated health system in California, and worked for about a decade at Kaiser Permanente because I loved their system in the sense that they make more money if they keep you healthy. They keep you out of the hospital and alive.
Yep.
And it's a different model than most fee-for-service models in the United States. And so I guess to answer your question, those things, and I began to learn, and then COVID hit.
Yeah.
And when COVID hit, a lot of things changed for me with regard to my faith in the system. We've known for a long time people don't apply research. We know way more than we do.
Yep.
I mean, we're in the information age where I just lost faith that publishing papers would be helpful because I didn't know that anybody was going to take them and do anything. So when COVID hit and I realized that people's beliefs were so strongly held that depending on who they liked from a political standpoint would totally dictate what they believed happened with an infectious disease and what the appropriate care or treatment was, I thought there has to be a different way. I just had a good opportunity with a friend that had talked to me, a mutual friend of ours, Dave. Wright had been talking to me about Bitcoin and blockchain for a decade. I told him it was a scam and only people went to the quote dark web for bad things because I didn't realize all the good things that came from it. So that was, shortly after COVID is when I took that huge leap of faith. My wife, bless her heart, was like, "You're going to what?" And so that's, really Galvan is trying to use some of the benefits of new technology to help people to own and be rewarded for making good decisions for their own health, not to be beholden to. It's not that you don't still need physicians or health professionals, but giving you the tools to be able to do as much as you can yourself. And there, we'll talk more about this because there's so many potential benefits once we move to a new platform that people have control of. So that's a long answer to a short question, but that's kind of what got me here.
No, I think that to me is, the one of the central issues that we have today is we have such a complex system, and the patient is not empowered. They don't really own their own health journey, right? They if you have something wrong with you, you're not in control of that situation, and I'm not sure that's I mean, the good old days when you had a community doctor that, you trusted and said, "Hey, doc, take care of me." I mean, I get that. And there's some romantic stuff about that, and that works for acute things. Johnny falls out of the tree and breaks his arm. I take him to Dr. Sharp. He puts a cast on. That's great. That works just fine, right? But where things start to become a challenge, and I think where our healthcare system really starts to fall apart, is where we have long-term chronic diseases that are very complex, that have a lot of comorbidities associated with them, where multiple doctors get involved in managing the patient. It becomes extremely, extremely difficult. And the patients, I think, feel like they lose control. They're not in control of what's happening to them, and they're not empowered to actually own their own journey. And I think that's one of the things that I think I'm excited about to talk about Galvan. But before we jump into that, I think you also had an experience personally that kind of gave you a different perspective, because it's one thing to be a healthcare professional and to study all this stuff and to provide care, but it's another thing to be on the other side of it, right? Where you're the one receiving the care and someone that you love receiving the care. So if you don't mind, I know it's personal, but share a little bit about your experience personally with your family and dealing with healthcare issues and how that's kind of shaped your thinking as well. BioHive is a nonprofit building, branding, and bringing together Utah's fast-growing life science ecosystem. Get involved today. BioHive's Women in Technology and Science community hosts events for anyone and everyone wanting to support women in life science STEM. And BioHive's Health Tech Hub community hosts events for those operating at the intersection of health and technology. Register for events and see what's buzzing at biohive.com.
Yeah, well, I'm happy to share this because I feel like I want others to have the same good outcome that we have been able to experience. So as I mentioned, I've got 4 kids, 3 boys, and my youngest is my daughter. And almost 10 years ago next month, she had been perfectly healthy to our knowledge up until that point. And she went from that to all of a sudden told me she had a headache. And then she threw up, and then she went unresponsive in my arms. And because of my training, her right pupil was blown. And I knew that we were trained that means increased elevated intracranial pressure. Well, that typically happens in older adults with high blood pressure and things. And I remember I don't have a high opinion of him, but when we first got to the emergency department after the paramedics picked us up, I told the story. And the doctor looked at me. He's like, "Kids don't have head bleeds." And I said, "Well, go ahead." And I'll never forget looking over his shoulder 5 minutes later when the CT scan showed a giant head bleed. And, he lacked in any sort of ability to communicate with patients, but he did what was needed. He intubated her and got her on a ventilator, and we got neurosurgery in there to relieve some of the pressure on her brain. So she survived. And, then it was a lot of waiting. Anyone that's been in this scenario, it's like, hurry up and wait. And, you, as a parent, if you've ever been through anything like this, it is the worst. It was my worst nightmare come true. And, long story short, Scarlett ended up being diagnosed with a rare brain tumor. I'll throw this out because this is something that everybody asks me about and everybody wonders. I was lucky because I did have medical training and research training, and I knew a lot of people, and just so happened, I think through heaven's blessing, we had a good friend that worked at the children's hospital across the street from the hospital I worked at. And he was a world expert in rare brain tumors. And, he was part of the miracle that, we experienced with Scarlett. But everybody asks, what am I getting the right care? I mean, that's the question is do I need to take every resource I have and try to get to whatever, fill in the blank with the world's best health care delivery system? And for me, we didn't do that. We ended up, I remember going to meet with a radiation oncologist, and they said, "Oh, well, we can do radiation, and we know that for this type of tumor, it's not curative. It'll slow growth because of its location, right where it was near the pituitary gland. It'll leave her blind because we have to go where the optic nerves are, and because she's 4 years old at this point, she'll have no further neurodevelopment, and so her ability to grow and develop cognitively will be impaired and stop at the 4-year-old." And this was palliative care. Yeah. This was stuff that was supposed to be Again, not curative, but palliative. And I just looked at him and I said, who would do that?
Yeah, who signs
Why
up for
would,
that?
yeah, how is this palliative? Palliative is supposed to relieve pain and suffering and
Yeah,
get rid of symptoms, not make you blind and make you unable to actually
yeah,
grow. And so, long story short, we ended up, they did some, at that time, it wasn't normal to do genetic tumor markers for genetic changes. And she had one. And it just so happened that her particular genetic tumor marker was one that had also been found in adults with melanoma, a totally different cancer than hers. And because her prognosis was so bad, they offered it to us. And I think they offered it to us because they knew, because of my background, I understood the risks that I was taking. I understood it'd never been tested in kids.
yeah.
It's not recommended that you do that.
Right.
But if your alternatives are your child's only going to live for a few months and die, then the risk for us was totally worth it.
Mm-hmm.
And turns out 10 years later, they've now studied it. It's now the standard of care for kids with her type of tumor, with her type of genetic mutation. And she's even off of the cancer medications. They found that they've even been able to reclassify what used to be one lump sum diagnosis because of the way they looked at it on a slide. Now with methylation testing and whatnot, they were able to subcategorize her diagnosis, and it has a much better prognosis. And so now she's able to grow, and she's turning 14 soon. And so, what does that story have anything to do with anybody else who's listening? And here's what I would say. If you're not a physician with decades of health training, that's unfair.
Yeah.
That's what I felt. I just felt like anybody else that would not have been equipped to be able to have the information necessary to make the best decision. And there was no clear answer. That's the part that we don't tell people is when we say there's a 90% chance, we don't know if you're in the 90 or the 10.
Exactly. Yep.
And everybody should be able to understand that. And so, that's part of what led me to a more decentralized system where people can get objective information. They can input their information as it is. I learned in that, and I knew that if, we saw mistakes made, and I think we got absolutely world-class care.
Yeah.
And there were so many mistakes that we found. And my wife had to call literally every single month for 10 years and convince the pharmacist that they needed to order Scarlett's medications because it was too expensive for them to have, enough in the pharmacy. And we knew if we didn't get it, within a week window, it wasn't like, then we felt like it was life threatening if she went a couple of days without her medication, because that was what was believed. And the system, though our outcome was amazing, there were so many problems in the system. I just thought, I want everybody to have the control to be able to make their own decisions and not be hampered or impaired based on geography or based on even finances or whatever it may be. So, that was our really terrible story that had the outcome that everybody hopes for. But it was 10 years of blood, sweat, and tears. And even though she's doing so great now, like, she still has a shunt, and if you don't know what that is, it's, it helps to relieve pressure with people who need it. We don't think she needs it anymore, but to remove it is to cause more risks than benefit at this point. She's had a couple seizures, and so it's, now she's in that chronic disease management that, we get MRIs every so often just to make sure things haven't changed. And so now we're, though I didn't understand that when I went into, medicine, that's just the reality for all of us. And the question is, do you trust that you have the information that you need to make the right decisions? Do you trust that you have the tools available to you so that when you are interacting with health professionals, that you are getting the information that you need? And when is it worth it to, sell the farm and move to wherever, Mayo Clinic or whatever you think is the best clinic? And when is that just going to be a complete waste of resources because they don't know anything more than the people right next door that are caring for your kids? So that was part of my personal story that made me think I want a system where people have more trust. They don't have to filter it through whatever insurance will pay for or whatever, the health professionals in their region know about. And that's possible. I mean, we live in the AI age. We live where no one should be shortchanged on the possibilities and the risks and benefits of those things. And that's really part of, again, why Galvan exists and what we're trying to do.
Well, I think that to me, that's the perfect setup for explaining the problem that Galvan's trying to solve. And at the end of the day, anyone who's had the kind of experience that you've had, and I think unfortunately a lot of us have, right, with loved ones or ourselves, dealt with those types of healthcare problems that have been, that one way or another, the outcome could have been completely different without being in the right place at the right time. And I'm not sure that counting on luck or divine intervention is going to work for everybody, right? I think that's that's something that is a fixable problem, and I think that's what I'm excited about. What you're trying to do with Galvan is it's a huge problem, but it's a solvable problem, and I think that shifting the focus of how our healthcare system is constructed. So for everybody that doesn't know how a hospital system works or a healthcare system works, I mean, it really rewards treatment, right? I mean, that's what it's all about is the records that are kept. It's largely your electronic medical record is not to tell you how healthy you are. It's to tell you what can be billed for the procedures that are. I mean, it sounds terrible, but it is the reality, right? That we all think that we have this medical record that captures a snapshot of who we are and what our health is, and where we're at, and that's not what it is. It's our health records are really, we had this procedure and we got charged this much for it, and this is the billing codes that were associated with it. That's what medical records are. And I mean, I think when people start realizing that, it's shocking that's the way it is. So we have a system that really rewards treatment, and it rewards, trying to treat sick people. And there is really no reward at all for trying to keep people healthy, right? And maybe there are some few examples, and like you said, Kaiser Permanente's one where they're both a payer and a provider. So they're the insurance company, and they're the ones also providing the care. So they actually have an incentive to say it would be better for us if we don't have this person show up at the emergency department of the hospital, right? I mean, that makes a difference to Kaiser, and so it certainly. The incentive is a little bit different there. But the reality is most of our system is really built around rewarding treatment and not rewarding health. So how does Galvan fix that? Or does Galvan fix that? Or how are you thinking about fixing that?
Yeah, well, it's a really good point. People should know the electronic health record, which is $1 billion industry, its ROI is by maximizing billing. I mean, that's exactly what their model was built after. Go ask any health professional, and don't let me bias you. Go ask someone how much they enjoy using the electronic health record. Yeah. And you would think it was supposed to be so efficient and help free us up to be able to spend time with patients. And that is certainly not what has happened up until now. And I'll use this perfect example. So turned out, and I share this same one because it's so simple. Turned out, and you'll understand this, but I took a medication called Bactrim. It's a sulfa medication. Mm-hmm. And so I had this little thing on my lip that was an infection and it wasn't going away. And so somebody prescribed me Bactrim. Well, I didn't have any allergies up until that point and didn't know. And then I started to get this weird rash, and I thought, I don't think this is the Bactrim, but I don't know. And so I stopped for a few days. The rash went away. It's like, I'm going to try it again. I started it up again. And sure enough, the rash came back worse. Even my lips started to swell up. And I couldn't put in my health record, my health information. Yeah. I couldn't insert that I was allergic to sulfa medications because you're not allowed to actually input that. Someone else is in total control of it. And that is part of, and we'll get into a little bit of the few things that Galvan's doing, but part of what we're doing is providing the ability for people to have a health record that's owned and operated by them. Though Galvan provides the tools, I don't have access to it unless you want to give me access to it. And so, even just knowing the medications you take and why, and what you're allergic to, and what happens when you take those allergies. As a physician, when I'd ask people, what medications do you take? And they told me, look in the computer. They didn't understand. The computer doesn't tell me if you're taking your medicines. You are the only person that can tell me if this morning you woke up and you took your medicines. Yeah. I might be able to see what you were prescribed. If you're in a good system like ours, I can see even what the pharmacy gave you, but I don't know if they fell down the drain or if you took them, and people just don't. So the number one thing that we want to do with Galvan is help people understand your health is your responsibility. Mm-hmm. If you are relying upon anybody else Any other entity, as amazing as they are, the best physician in the world, best system in the world, is not as good as you, because your health is yours. And that is what, so in terms of what Galvan's doing, providing a personalized health record so that you can take your health information, own it and operate it, share it with whoever you want, take it back when you don't want them to have it, and just begin to own it is just a fundamental basic starting point of where we're starting.
Yeah, no, I think that's the other part of it is this stuff is not transportable either. It is very, very difficult. I mean, theoretically it is, but functionally it is so challenging to say, hey, I'm going to move from here to here, and I want everything that this system knows about me to go over to this system. It's like moving a mountain to make that happen. And most people just don't care, right? They're just like, or don't even know that that they should care, right? that should be something that they should worry about. But yeah, it is. I think
this, Dave. Yeah. This will tell you where health systems are with it. They're going to want a fax number, and they're going to want to fax 500 pages of totally random paperwork and let you sort through it. Go try it. Go see, because the health records weren't built to even communicate with one another. And it's just not, I mean, fax machines. If anybody thinks that a fax machine in our current time is the best way to share information, well, that's okay. I disagree. And I don't think that's what any of us want our health to rely upon.
Yeah. It's fascinating that my children don't even know what a fax machine is, right? They have no concept that, we over a phone line that we transmit information to a printer that prints things off. I mean, they're just like, that's the dumbest thing I've ever heard, right? So, and I run clinical trials all over the world, and the majority of our information is shared by fax machines, which is just crazy. So you're exactly right. So I guess that leads us to technology we have technological tools available to us. I think everybody listening has heard artificial intelligence. Everyone's probably heard of blockchain. They might not know what it is, but they know that there exists out there. There's these technologies that are impacting our everyday lives, and they're just not impacting health, providing healthcare, the actual administration of healthcare, and especially solving the problem of letting patients be enabled to manage their own care. And so I think that's what I really am excited about. What Galvan's trying to do is to utilize these tools that are now available to give people an opportunity to control their own information. And it's theirs. And to be honest, they're the only ones that really care about it, to be honest, right? I mean, they should care about it more than anybody else. I mean, your doctor loves you, but he has thousands of people that he loves, right? And so he gives you this much of his time. If you're not sitting in front of he or she, your doctor, they're not thinking about you every day. You're the one that needs to be thinking about your health and what's best for you. And you need to be educating yourself, and you need to be, empowering yourself to control your own health. So that's what I'm excited about. So one of the things that I think, that Galvan, that my interactions with you and what you've been doing with Galvan is trying to create a culture of health instead of let's wait until I get sick and then I'll think about, I'll think about healthcare when I have cancer, or I think about healthcare when I have a heart attack. Then I'll fix something. But what does it mean in practical terms of, what could we do to empower people to start thinking about their own health ahead of this, and how do we make that culture change, because it definitely is not part of our culture.
Yeah.
What if you could get rewarded just for being healthier? Meet Galvan, the company using the latest blockchain technology to reward you for taking care of yourself. They help with your mind, body, and soul like a personalized health assistant to track your progress and help you feel better. Galvan's G Plus app rewards you for exercise and assesses your mental health in under a minute using AI and over 2,500 voice biomarkers. If you're feeling off, G Plus gives you personalized power-ups, science-backed techniques to help you feel better fast. And here's the best part. When you prioritize your wellness, you earn crypto. Ready to level up your health? Use promo code GOODMED20 at checkout for 20% off. Download G Plus today at the Apple app or Google Play Store and start your wellness journey with Galvan.
It really is not. And, you may know this, Dave, but I didn't know this till recently. I always thought, even the term patient, we think that the term patient is, you have to be patient because it's going to take forever for you to get in to see your doctor, or you're going to wait in the office for forever. And really it comes from suffering. Like the origins of Western medicine is once you get sick or hurt or injured, then you come to us.
Yep.
And so that's how we're built. And so it's not that primary care hasn't begun to try to emphasize preventive measures and things like, educating people about sleep and nutrition and exercise, which are invaluable to your overall health. But they're not paid for it. They're not compensated for it. The insurance does not, if I sit and talk to you for 30 minutes about what you should be eating, the reality is I haven't been able to help people that are coming in for things that I am well trained to help with.
Yep.
And so, and then you have the wellness industries, which are not as regulated and don't have often some of the resources with scientific rigor and some of the things that Western medicine comes, but they actually do help with some of these preventive measures. And this is where I think, in my life, I've had people that think, oh, I'm never trying anything, acupuncture or any of the maybe East meditation. Oh, that's just voodoo. And then I have people on the other side who I love. They're like, I don't trust doctors. They're just doing this to make money. Those are poison medicines they're putting in me, and they don't ever go. And the reality is we live in an era where we can put those two together.
Yep.
And I think most people would like to do that, to be able to pick and choose, hey, here's 3 things that work. Which one do you prefer? And I like, we've talked about this, so I still hope, Dave, you invent a medication that is just like exercise. But until then, I think going to exercise, and that's why we started with Galvan, is if you can proof of action. So, I've got whatever version of wearable. We know, I went with the old health system. We went and met with Google, and they're like, we can measure everything. And I was thinking, well, I'm a physician. I don't know what to do with all of that. And the reality is like, if you tell me someone's minute-to-minute blood pressure and oxygen levels and everything at home when they're doing fine, that is not what we've been trained to know how to do. And so we should begin to understand that. But the reality is starting with exercise, you can track your heart rate. So we can confirm on a blockchain that's not run through any single entity, but hosted by people who have decided to be part of the Galvan community with their nodes around the world. And we reward you. So we want, worked in a system where physicians would be rewarded. The system would be rewarded if they did well, but we didn't reward patients.
Yeah.
And I thought, well, why don't we go reward people? If I exercise, my doctor shouldn't get any money. I should be rewarded.
And that's right.
And that's part of, what Galvan's trying to do is to be able to confirm healthy actions like exercise, or, the other part that we may get into is mental health. What a catastrophe with all of the mental health problems that people have. And I was just telling you earlier, I looked up this morning to see what the most recent, 48 days is the most recent average wait time to get in to see a behavioral health specialist. 48 days.
Yeah.
Well, so, who can wait a month and a half before? You should maybe book the appointment 2 months before you think you might have a mental health need, and then maybe you'll be ready, but that's not okay. And so we've partnered with some folks that are amazing. In fact, I think they've been on here, Canary. And so we have the blockchain rights to voice recognition that can tell you where you are with regards to your, we call it stress. The clinical diagnosis is anxiety, or we call it mood. The clinical diagnosis is depression. We can tell you today, talking into your phone for 40 seconds, how you are. And then we can give you things that you can actually do immediately that are proven to help. Now, if you've been doing those things for a month and you're still not doing as well as you'd like, well, then it's time to go see somebody to potentially add something. So that's what Galvan does, is it puts things in your control and helps you to see. We know exercise and mental health, there's nothing better that you can do for your mental health than to exercise. We know that. It's as effective as any of the medications, maybe more so, certainly without many of the side effects. And so that's part of what we're doing is, people often don't know what crypto is. And this format's not to train people on crypto, but if Bitcoin takes a smart contract and does a math algorithm and consumes energy and outcomes of Bitcoin, and then computers around the world are able to track it. Well, that's transparent. You can go look at who owns what and which wallet for anybody. And so what a great system that we have tried to take a technology where the same thing can happen. Imagine if everybody was able to pay the same amount for the same medication.
Yeah.
Does anybody think that that's not a good idea?
Yeah,
Because
yeah, exactly.
do they think that their kid, when your kid gets sick, you should be able to pay $500 and the other guy should pay $5,000? I mean, why do we say that's okay?
Well,
we can fix that.
Even know what it is that you're actually paying. Most of us have no clue. Like, it's like, I'm going to procedure. I have no idea what it costs, right? So let alone does it cost something different other places? But it's just the weirdest system. But it just, and it's all fixable. I mean, we have technology that can actually make a difference. So yeah, I think this is, so Galvan as a system. So help us just kind of walk through the process of how do I interact with Galvan? What is, I know I can carry a phone around. All of us do. I mean, I don't know what percentage, but it's almost everybody in this country has a phone, right? And almost everybody has a smartphone. And a lot of us wear wearable devices that are measuring things that we may ignore, we may pay attention to. I mean, I have to say that this has changed my life. I mean, it really has. It makes me aware of things. It makes me feel guilty all the time. It's like, hey, lazy, get up and walk around. Go. You shouldn't be sitting down for 10 hours a day. Get up, get out of your desk and go walk outside. And it actually is helpful. It reminds me to do things that I know are good for me, but I just get busy. I'm busy doing stuff. And so this technology works. It makes a difference, but combining it into a interface that can help empower people. I think that's what Galvan's all about. If I were to explain it to people, that's what it's all about is Galvan consolidates information and gives you tools to measure where your health is and rewards you to make changes to positively impact your health.
Yeah, well, that's well said. So let me summarize. If you're thinking, oh, I'm not a tech expert, I'm not a crypto master, so I can't get into that. That's not true. You don't need to. I wasn't myself, and it's not that hard. The reality is so here's the fundamental part of what we did. The first year I was with Galvan, we sold nodes. Now, you don't even have to know what a node is. Think of node as a piece of software you can put on your computer, you can put it in the cloud, and it tracks transactions that happen on the blockchain. So that's where it's transparent. You can go and look on some of these scanners that scan crypto and see where things are happening. And people who own a node are rewarded in our cryptocurrency for supporting that blockchain. So that's the infrastructure. That's just what crypto is it's confirming transactions and being able to see them. It's decentralized because it doesn't run through, like, even though Galvan has put it out into the wild, we don't control that. It's already out there like Bitcoin. Somebody created it, but now it's out in the wild. And so that's part of this is the blockchain infrastructure. So the second part that we created, which is novel, and to my knowledge, nobody's really doing this. People are like, who are your competitors? I'm like, I don't know them yet, but I'd love to meet them because I'd love for us to work together to make this work for everybody. And so the next part is we created an app. You can go get it on the App Store, either Google or Apple, whatever you use. And what it is we call it G+. So G+, the first two things, it does a lot of things, but the first things that we reward is exercise. And it's proof of action. So how do you earn our cryptocurrency? Well, you do something, you go exercise, you confirm it with, we tried to be agnostic to device. Now, it would have been nice. Maybe it would have been a better business model if we sold the watches and said, you have to use our watch.
Yeah.
But we thought, well, why would we make, there's these devices everywhere, whether it's Fitbit or Garmin or, one of the Google devices through Samsung or Apple. We didn't care. We just want you to confirm. And if it's confirmed on your phone, then we will reward you every day. So if you get your 30 minutes a day, which is kind of the minimum, we know that 30 minutes a day does all sorts of things, helps you avoid cancer, cardiovascular disease, dementia, all sorts of stuff. Now, a little bit more might be better, but 30 minutes at least, and then get your 150 minutes a week. So that's part A, is we reward you for getting exercise that you should already be doing. And it's amazing what we know that behavioral psychology, a little bit of reward actually can go a long way.
Yep. Similarly,
this is where, again, as part of the G Plus app, you speak into your phone and it will track your mental health. And so if you get in and talk into it and see how you're doing, see where you are with stress, mood. And you may think, oh, I can trick it. I'll just say I'm having a good day. It's not listening to the words that you're saying.
Yeah.
It uses 2,550 different biomarkers, and you can go look at all the amazing things Canary's doing, but we implement that. And where we're unique is we will reward you with cryptocurrency just for checking in. And then we have a personalized health record. So you can we talk about your past medical history, your medications, your allergies. Now you have in a place you can show your doctor that you're actually exercising or you're not. You can actually show them the trends in your day-to-day mental health and how you're doing and where that's going, whether it's trajectory up or down or whatever it may be. And there's so many more things. We just launched, what we call the digital gym membership. So, and we won't be able to do this for forever, but if you have a gym membership, and we don't care wherever you go work out, we will reward you for going, depending on which level you get, 3 times a week or 5 times a week, or 8 times, 3, 6, or 8 times, even just a month. We will give you in our crypto the value of the membership, and you can pay for your gym for free. Now that's something that again is just the beginning of what we're doing, but it's taking information, taking tools that we know we have, put them in your hands. It's up to you. Once you prove you've done it, we reward you. And then, we hope we've given you more tools so that you begin to own, what you always should have owned, which is your own health and your own behaviors.
No, I have Adam and I have known each other for a few years now. We've thought a lot and talked a lot about how we can implement these ideas, and it's so exciting to see this actually happening, and it's inspiring to see somebody who's had a great career, had everything and lined up all this years of training, and said, you know what, I'm actually going to try to do something to make a difference for the world, right? And you're making a difference for one patient at a time, which is, we need that. We need doctors that do that. But to have somebody that, it's inspiring to hear your journey to say, I'm going to take this bold vision and try to reimagine how healthcare can work and start with low-lying fruit. If I can just get people to start doing things that are pretty simple things that everybody knows they should be doing, but if we can give you just that much more incentive, that much more reward to say, it's not something in the future that you're going to benefit in the future from your health, but I'm going to give you something today that actually is going to, something that you can actually physically, see on your phone. At least I guess it's digital, but you can actually see the results. So that's super exciting, and hopefully people, will you go check it out. Go see what Galvan's doing. Where you mentioned you can go to the App Store. You can go to either the Apple or the Android Google App Store. You can find the app there. You have a website as well, I'm sure you could go to. You want to you're at galvanhealth.com, is that right? Or yep.
Galvan.health, yeah.
No. Galvan.health, that's right. Galvan.health. Sorry about that. Yep. All right. Well, so I guess just wrapping things up. So what would you say to the listeners of that are concerned about I've never done anything like this. Is it really private? Is it really I'm worried about entering my information. What can you say to make them feel comfortable that this is something that they could try and that they can trust? Like what do you want them to know from that side of things?
What I would say is come and see.
Yeah.
Don't take my word for it. Like, I'm just a guy like everybody else. And it took me a little while to actually understand how important this is. And I think here's a question to ask yourself. Do you trust that the system where you're at, or whatever your current experience is with what's going on with your own health and the resources that you have, are as good as they can be? And if they are, then this isn't for you. Like this, that's okay. If you're content and feel like you're getting everything that you need, then it's not worth going to look at something else. I think that's not true for the majority of people. And the people who maybe believe that, it's because they haven't interacted with the system yet.
Yeah.
And I think if you want to change it for the better, that's the part of what this type of a movement is it's a decentralized community. The people that are a part of it can help. We have a voting mechanism where if we're not doing something right, it's democratizing health. And if you want to change it, if you want to start getting rewarded for your sleep, which we hope to do in the near future, well, then put it for a vote and let's make it happen. And so, that's what I would say is you don't have to be a software engineer in order to understand and do this. There are a few things. If you've never owned a crypto wallet and you don't recognize that, your words are your words and there's no bank teller that can actually override and control it. Well, that's both a strength and a weakness. But the reality is it's better. I think better ends up winning. If you remember, people have used this analogy. I think it's great. You remember the first time that you sent digital money, like the first time you didn't write a check and you sent it and you're like, did you get it? Did you get it? Did it? Because it was scary. You don't know if you just lost it.
How did that work? Yeah, it just disappeared. Yeah.
And crypto's the same. The first time it'll be terrifying. And then more and more you're like, oh, I don't have to actually go and ask the bank if it's okay if I do this. You ever tried to send a wire? I mean, I'll never forget when we tried to pay off our home and the bank, it took us 2 weeks. And I'm like, this is our money. What? Yeah. Why can't we do with it?
Take our money. Yeah, that's right. Yeah, exactly.
So, and I think all of the benefits that we know may exist in terms of transfer of funds can be applied to our health. There's nothing that's more relevant in terms of transparency and decentralization and optimizing. I mean, we haven't even gotten into maybe another time how to use your own personal information. We're at this nexus of, ChatGPT or whatever AI you like can sort through the hordes of internet information of which there's almost infinite amounts, but it doesn't know about you personally.
That's right.
And if you have a safe system that can bring that to a nexus and combine it with your own personal genetic and personal health information at a personal health record, well, now we're actually getting somewhere where people should be able to really trust what is known and what isn't known and help us make decisions when the time comes. And it's not if, but when. So why not be ready?
And why not Galvan, right? Why not Galvan lead the way? Yeah, exactly. Well, Adam, this was such a fun discussion and just it's so exciting to watch the progress that's been made. I would just recommend for everybody go download the app and try it. It's just the vocal biomarker side of things. It's very fascinating to talk to your phone and have it say, here's your mood and here's your stress level. And I have to say that I feel like it actually matches with what I, personally in tune with myself. I hope you don't disadvantage people for sleep because you'll be taking rewards away from me. Unfortunately, I know that's one area of my health that I'm just terrible. I don't sleep very much, and I need to fix that. So maybe if I was rewarded, I'd do a better job. But Adam, it's just been a delight to talk to you. Looking forward to watching what happens in the future with Galvan. And thanks to all of you for tuning in. If you enjoyed this conversation, please be sure to subscribe and share this episode with your friends and your loved ones, and keep us in mind when you're thinking about podcasts, and follow us to keep in touch with what's happening in the future of healthcare. And we're going to keep bringing you more interesting people like Dr. Adam Sharp. Thank you, Adam.
Thanks, Dave.
That's it for today's episode of Good Medicine. Thanks for joining us as we explore the science and stories behind health, medicine, and innovation. If you enjoyed this conversation, please subscribe to our YouTube channel. That's a great zero-cost way to support us. In addition, please click, follow, and leave a review for the podcast on Apple and Spotify. If you have questions or comments for me, please put them in the comments section on YouTube or reach out on all social media platforms at Good Medicine. Links are in the description. The best way to support the podcast is to check out the sponsors of the show. You can do this by looking at the links in the show notes. That's it for today. I'm Dr. David Beers, and we'll see you next time.